Right, this is why your sore knee has everything to do with your neck. True story from my week this week, and it's only Tuesday. Dun, da, da. Okay, so this lovely, lovely client comes in. She's recently had surgery on her knee because she snapped her ligaments. Very, very ouch. Surgery has gone well. Surgeon is very, very pleased. Knee can now bend to 90 degrees, top, okay? She has had multiple months of physio, and yet her knee is still very, very stiff. It's causing her still pain, and the surgeon says, it's one of those things. Well, no, it's not one of those things. The problem is that her body was probably breaking before the knee broke. So she fixed the knee, great, the knee is now perfecto in terms of surgically, biomechanically able to do its job, but what caused the knee to break is still an issue, and that's where I come in. So what we found on her lovely body this week, in an effort to get her out of pain in her knee but elsewhere, get her functioning better elsewhere, as well as actually being able to use this knee in the context of her whole leg, this is what we found. Her neck, okay, or let's change it around a bit. In your body, you have these two things on the side of your neck. This one does this and this. This one does this and this, okay? So they turn your body. Complicated, a little bit more complex. Your knee's job is to do this. Bend, straighten, not complex, okay? Now, her knees probably broke, or her knee ligaments probably snapped, because for multiple years, for lots and lots of decades, okay, she has probably been walking like this without realizing. In other words, this muscle has been overworking and taking her head out of alignment, which has then taken her body out of alignment, which has then taken her big leg bones out of alignment, which means that her knee, whose only job is to do this and this, has been struggling to do this and this because the leg has been twisting out, because the body has been twisting out, because the neck has been twisting out, and eventually the ligaments are like, I give up. You know what? Break, gone, sorted. And you'll often find that your body breaks in the areas where it's easy for it to break. So knees are an easy break, because it's not going to break your neck, it's not going to break your rib cage, it's not going to break your back. Your knee will be the easy victim, if you like, okay? So what we have done is got her to release with a little bit of massage this muscle, so that her head now does this when she's walking and swings from side to side like it is supposed to. When that is swinging on the top, that means that this middle of you can stay nice and straight and balanced and do its own little swinging as well, which, just for, the little story, la petite histoire, is the absolute opposite. Okay, so this should be happening. When that is happening, then legs can go like this, and it's called walking, okay? And when this does this, and when this does this, these legs can walk nice and straight, these bones can stay nice and straight, which means your knee, the simpleton, can do its bend and stretch, and bend and stretch, okay? So, getting rid of your neck pain will help your knees, okay? So, if you are watching this video and thinking, bugger me, I've got sore knees, please come in and see me, because it's not your knees. Your knees are the easy victim. It's probably something else. And if you're thinking, but no, I've got pathologies in my knees, I've got bad knees, I've broken my knees, I've got, proper problems with my knees, then you especially want to come and see me, because the proper problems that you've now got in your knees started way back when in another part of your body, okay? So click the link below, come and get assessed, it'll change your life. Looking forward to seeing you soon.